Welcome back. Severe acute malnutrition. It's dubbed as a silent emergency affecting an estimated 23,000 children in central Mindanao. Together with its project partners, UNICEF aspires to change that situation by using a community-based management approach to combat malnutrition. Here to tell us about UNICEF's malnutrition intervention program are UNICEF nutrition specialist Dr. Paul Zambrano and UNICEF special advocate for children, Daphne Osenia Paez. Good morning, guys.
Hi, Lexi.
And you're fresh from Mindanao.
A few days. A few days ago.
Because,
yeah,
well, I saw it on your Facebook page that you were going down there. And, Doc, you're used to going down to Mindanao.
Yes.
Or UNICEF. You actually lived there for a very long time.
Yeah, end of 2010, I was permanently based in central Mindanao.
Okay, and now you shuttle back and forth.
Yeah, back and forth.
Okay, so maybe we can talk about malnutrition first, Daphne. Malnutrition, for a lot of people, you assume that it's about little kids who don't have enough nutrients, I guess don't have enough vitamins and minerals, or they don't have food. But malnutrition can also mean overnutrition, or I guess the obesity problem in America. But obviously the problem that we face here is that they don't have access to food, to different vitamins and minerals. What was UNICEF's take on that? Because this is actually a project by Save the Children, right? This is a venture from Save the Children?
Save the Children is the partner on the ground.
Yes,
it's a UNICEF program. Now, when they had told me about this situation in Maguindanao about the severe acute malnutrition, I had a lot of learning to do, because for me I thought that malnutrition was, I mean, here in Metro Manila we see kids who are malnourished.
Yes, of course.
Who have big tummies because of bulate, who are so thin, lack of food. But the situation there, these are kids with severe acute malnutrition. They got to the point of being severely malnourished. Yes, because of not just lack of food, but because of diseases and the conditions of living there. So we saw babies that were so thin. Images that you would only see in other countries that had famine. So I was very emotional when I first saw the stories. Yes, I'm a mom of 3 daughters, Sophia, Lily, and Stella. But yeah, so I mean, you don't have to be a mom to be sensitive when you see images like this.
Of course.
And so initially I thought, okay, well, they need food, you know, but there's just so much to know about severe acute malnutrition. It's not just the giving of food and handing out of food. They need to be treated.
Right.
And UNICEF has been working with this for decades, and they've come up with ways that are efficient and effective and like inexpensive. And they do this around the world, and it's been proven effective. And Dr. Paul can talk more about the treatment.
But what are the telltale signs? I mean, obviously, we know that when we see a thin child, there's a little cause for concern. But how do you diagnose this particular problem?
Well, first, there are actually different forms of malnutrition.
Right.
You have what's called wasting, or children who are dangerously thin for their height or length.
Okay.
You have those what we call stunted children who are too short.
Too short, right.
Too short for their age, and you have the micronutrient malnutrition, like those who are anemic. But for severe acute malnutrition specifically, there are actually ways to diagnose it. One is to measure the weight and the height, and you convert it to what's called a Z-score, and then there are international cutoffs for you to be able to diagnose based on that score.
Well, it's very scientific, isn't it?
Yeah, but there's also a very simple.
This is called a mid-upper arm circumference tape. One of the easy measures actually to diagnose severe acute malnutrition is to use this tape. We call it MUAC, or mid-upper arm circumference tape.
Okay.
It's basically used to measure the middle side of the upper arm of the child.
Okay, you're going really thin there, Doc.
Yeah. So there's a red. If the child is on the red zone, it's a centimeter measuring tape.
Right.
So if it's 11 centimeters and below.
Yeah, so the cutoff is 11.5 centimeters and lower. Then you will diagnose the child as having severe acute malnutrition.
Oh, wow.
Imagine a child that had arms like that.
Exactly. I mean, even on the yellow, you're already bordering very, very thin. But did you see children?
I saw on our first day there, I met a child named Datu Ali. He was 7 months old, and he looked so small. The image that really struck me the most, aside from his eyes that were so sunken, were his fingers. His fingertips of a newborn. It was wrinkled and pointy, and
usually it's. Well, I have a 7-month-old, so usually they're already chubby. Yes, they're chubby at this point. Oh my goodness. I mean, how was the experience like though? I mean, going down there, knowing that there are certain risks going down to Mindanao. Did
Well, for me, as an outsider looking in, I had to condition myself. It wasn't about me. It was about the program on the ground, and I wanted to tell the story.
Right.
So I got over my initial reservations, and I was assured that we would be okay. And I mean, we have a team working on the ground. That they've been there for 2 years, so they're okay, and I would be okay. So we're fine with that. And when I got there, seeing the child, at first, of course, you're overcome with emotions as a mother, as you know, seeing
But you
these
sort
images.
of can't show them that.
You
can
can't
you?
because the mom is there, and they're there for treatment, and they were very hopeful. And when I saw the child, Datu Ali, with looking so thin, but he was also very responsive. He was
Right.
already showing signs of recovery.
So you knew he'd be okay.
Yeah, and
if
I
he
knew
got
that the
proper
program
treatment.
would work, and it's a very, very simple intervention, and it was not expensive, so it was very hopeful.
Right.
I liked being there. I knew that the program was on the ground in many municipalities and barangays, and this is something that we hope to take on a national level, because Maguindanao is not the only part of the Philippines that has severe acute malnutrition.
That's
I'm
what I was
sure it's all
wondering though.
over.
Why did you target Mindanao at first, or do you have these programs everywhere else, and we're just highlighting Mindanao at this point?
Currently, the program is in central Mindanao, specifically in the provinces of Maguindanao and North Cotabato.
Because this is where you feel probably that they need it the most.
And it was actually a result of an assessment, nutritional survey, which was done in 2009 after there was a big conflict around 2008. And then there was the prevalence of malnutrition, which was found in those areas, which was found to be at a level indicating an emergency nutrition scenario, which necessitated urgent intervention. So actually, this program was a result of that assessment, which is why we're starting in these areas. But with the model we've established in Central Mindanao, with the good partnership we have with our partners on the ground,
Yes, correct.
and mainly, of course, the Department of Health, we are now looking in the direction of making this a program which is available nationally, because we don't expect severe acute malnutrition only in Mindanao. Like Daphne said, it's not simply a lack of food, but a lot of interacting factors, which you will find not just in Mindanao, but
Right.
actually even in Metro Manila.
Exactly, exactly. But the survival height rate, the height, is really big.
Yeah,
what's the percentage?
Without this treatment, children with severe acute malnutrition have 50 to 70% chance of dying,
Yes.
of not surviving.
Yes.
But with the treatment, 95% will live.
Okay.
So, I mean, and
it's a big, because I was reading the notes and I'm like, well, this is a big hike.
Yeah.
As long as they do get the treatment. So what can people out there do to help with the treatment? Because obviously you guys are there on ground helping out, but you also need support from everybody else, right? And how much a day does it take to help one child, let's say, beat this problem?
So just to give people an idea about how the program works, so it's a community-based approach to managing
Correct.
acute
So people
malnutrition.
are always there.
So because traditionally we manage all cases of malnutrition are treated in the hospital, but it was found that this is not an effective and not a feasible approach, especially if you have a lot of children malnourished. So in this particular program, children are managed actually in the health center, in the community level, except when they have complications. So under the program, they are given ready-to-use therapeutic food.
Okay. What is that, Doc? Maybe you can talk to me. Well, they look like something that you bring, like an astronaut would bring to space. What exactly is in that?
Okay, this is ready-to-use therapeutic food, or RUTF. This is actually a peanut-based therapeutic food, which is used to rehabilitate children with severe acute malnutrition.
What is the main
It's
ingredient,
like
apart from peanuts and
It's soft. It's a paste. It's like a peanut butter with nutrients. It's loaded
so it's
with-
jam-packed with all of
it's
these
jam-packed.
vitamins
It has
and
all
minerals.
the essential micronutrients, and in terms of calories, it's really designed for children with severe acute malnutrition to rehabilitate them, to bring them back to normal nutritional status.
And these are for children of what age? Or does it work until...
The program is targeted for children 6 months to below 5 years old.
Okay, so it's
Because
really
these are
for the
really, this is
younger-
really the age group that is very high risk of developing severe acute malnutrition.
Okay.
So aside from the therapeutic food, they're also given routine medicines.
Okay.
And then every week, a routine medical checkup is done to check for any complications. And the mother is given counseling as well on breastfeeding, good complementary feeding,
Yes, of
any
course.
nutrition advice, especially if the mom has other children. So this is done at the level of the health center.
It's pretty amazing. They just need 2 to 3 packets a day, right?
A day.
And they
Yeah.
just,
Okay.
wash your hands. Everybody wash hands, mom and the child wash the mouth, and they just suck it slowly.
So it's
And then you
almost
see
like
a gradual improvement.
Yes,
you
it's
know.
almost like a almost like a very fortified sort of. What is it? It's pasty.
Yeah, it's pasty. Yeah, it's soft and pasty.
And they can finish up to 3 of these a day.
yeah, but it's given in.
Yeah, it's given in a weekly ration, and then it's
Okay.
computed sachets per day depending on the weight of the child. And then the mother is given advice on how to give it, so it's ready
Yes.
to use. Nothing, you don't need to prepare anything.
Yeah,
All
no
the child
water.
needs is clean water to drink
Right.
while they're
And you have to keep
eating
it
this.
properly so no bacteria gets in
Right.
there.
Actually, one of the advantages of this therapeutic food is you can actually store it for long periods.
Right.
You don't need a refrigerator. You don't need any special storage. Just make sure it's not exposed to insects
Of course.
and to direct sunlight. So it's advantageous in a setting like Mindanao, where you won't expect much of the affected population to have refrigerators. and like
Because these are people who have been displaced
Of course.
by flooding, even. And at the same time, these are not just given out. We don't, UNICEF doesn't just hand them out.
Because people are
they're
enrolled,
enrolled in a
right?
program. They're monitored, and the mothers and the parents are also given sessions on how to, eventually get them back on
So
track.
it's a holistic sort of. It's not a one-off.
Yes,
like-
it's not food distribution.
Yes.
It's a
It's a
program. It's a protocol where you need to be enrolled to be able to, and you need to be with severe acute malnutrition.
Yes,
So
of
this
course.
isn't given blanket to all children, because
Yeah.
you really need to follow the treatment protocol for you to have the good treatment outcomes.
So many questions still.
The amazing thing about this is that it's very inexpensive.
Right.
And that's the reason why we are going around and telling this story, is that with just 600 pesos a month, you can help kids with severe acute malnutrition. You could save 3 children
With 600 pesos a month.
Yeah,
Okay,
that's
so
it.
invite everybody to do so,
Yes,
because that's I mean, for people who can afford it, what is it to give 600 pesos?
That's right. So we're inviting you to please check out the website of UNICEF, and you can donate to www.donate.unicef.ph or call 758-1000. Again, 600 pesos a month. Your pledge can save up to 3 babies' lives, and it's very, very. It's proven effective. It's cost efficient. This is done globally, and right now in the Philippines, only available in Maguindanao. And Paul and the rest of the UNICEF team are doing amazing things down there, and we hope to take this to a national level.
Well, you guys are heroes in your own right. It's a good way to start a Monday, guys. Go and pledge for UNICEF. Thanks a lot,
Thanks so much,
Daphne and
Lexi.
Doc Paul, for being here, and continue the good work that you do.
Thank you.
Thank you.